Hi all, thank you for joining us for the next in our webinar series. Today we have Greg Lehman from Toronto over in Canada, who is a clinical educator, physiotherapist and chiropractor, and also a strength and conditioning specialist as well. Greg has over 20 years of experience within the field and does a lot of work around the spine, and all things associated with kind of back injuries, back pain, lifting and everything around that. Done some great research and great work, some of which is a little bit different to some of the traditional literature you might read, and has some very good views that are very applicable to us in the field of strength and conditioning. So I'll hand over to Greg today, and I think he'll take a bit of a Q&A at the end as well. And hope you all enjoy the webinar. Thanks, Greg, for joining us.
All right, thanks for having me. I'll jump right in. So I'm going to start sharing my screen, okay? Desktop, sure. Okay, there we go. Actually, what I typically do, I've done a lot of these over the past year now. If you guys, if you have questions or comments, if you could throw them in the chat box, and I can often see them as I'm talking, and address them and work it in, because this is a massive lecture. I've been doing this for 5 years now. We with Louis Howe, we wrote a paper about this, about spine flexion and neutral spine and all of these things, and that just got published. So all this is published as well. And in the lecture, there's extra slides that I'll give everyone access to. I just want to have them, like, we're not going to cover them. I just want you to know that they exist so you can see them, and then you can read up on them if you like, or if there's questions, I'll jump into that slide. So it's a bit unorthodox, but I don't want to skip things or not give some cursory mention of things if it's relevant, but I will focus on the big stuff. So I just have to make sure I can see the Q&A. There we go. Oh, no, not Q&A. Is there no chat box? Oh, maybe there is no chat box. Oh, well, you can just throw the questions in there in the Q&A if there's no chat box. All right, so let's get rolling here. So this is the spine flexion debate, which is just a mess. It's part of this series I do called Reframing the Kinesiopathological Model, which for so long in physio and strength and conditioning, I was certainly like this 20 years ago, we would be a little bit too worried about deviations from neutral and how we lifted, how we ran. And the argument that has been around for so long is if you deviate from the neutral spine or from a neutral knee, or if you pronate a lot, you are much more likely to get injured. And when you look at the literature, it's an assumption and a notion that's surprisingly quite unsupported. And so today we're just going to talk about this spinal flexion idea. If you asked me 20 years ago, I'd be telling people, don't do yoga, don't stretch your spine, try to keep your spine as rigid and neutral as you can. And then through the years, as I've looked through the research, I've sort of challenged that idea. So really what we're asking here is spine flexion, bending your back more, an independent risk factor for low back pain, right? And so if it exists, is it truly a faulty pattern? So if we take someone, this is Dr. Austin Baraki, he works with barbell medicine in the States. He's also a medical doctor. He's lifted for more than 12 years.
Lift 15-pound PR.
And he has a quite flexed spine. We'll see later. This is probably about 80 to 90% of his max lumbar spine flexion. And for so long, people would say that this is faulty, this is a bad lifting technique. And I would argue this is advantageous. Biomechanically, this is good for him. It helps him get the weight close to his body. For whatever reason, it helps him get his hips and his glutes in the right length tension relationship. His lumbar spine is probably in the best length tension relationship. And some would say that he's more likely to get injured in the future. And so I would say that's just a notion right now that's currently unsupported. So Yeah, so he's lifting here only, it's only for him, around 6, I think, in his lifts. And then we have someone who, this is Maddie Rogers, who would have less spine extension or less spine flexion during the clean motion. And the difference between the lifts here, this is just an hypothesis that I'm going to throw out there, because we'll talk about performance a bit of when biomechanics matters. When you don't have a lot of time to produce force, right? So that would be like the snatch or the clean versus the deadlift, you will probably have less spinal motion. So that's why you see in a lot of people when they do something fast, like running and jumping off of one leg, you won't see the spine involved that much. But if you can do a 2-legged vertical jump, you'll see people go down, flex their spine, and then extend it. It becomes part of the kinematic sequencing. When you don't have a lot of time here, like with the clean, you'll see less motion there. But if it's your Austin and you're deadlifting, you have lots of time, then the spine can get involved. Anyways, we'll get into that. So our debate here, some would say, fine, Austin can get away with that now, but he's going to pay for it later, right? So the crux of this debate is it wear and tear that he's putting himself under, or is it wear and tear, or is it wear and repair? So we have this debate of, how does he tolerate this? And is he adapting, or is he actually wearing away till one day he goes to put on his socks and his back goes out? So he finally paid the price of his bad spinal hygiene through the years. And that's the debate right here. That's the crux. So if some people say it's unacceptable, they'll say he'll pay for it later, or they'll say people like Austin, there's something special about him, right? He's a survivor. The average person, they wouldn't be able to lift that way, and they would definitely be injured. So there's something special. He's surviving where others wouldn't, and that's sort of the debate that we have. And so I always do this lecture in person, and I'll do it online and say, you don't have to believe me. And if you disagree, that is totally reasonable as well. Because right now we're dealing in an area where there's a lot of research, but it's still quite murky to have a strong opinion. So it's okay not to have strong opinions here, and it's okay for us to disagree. I see John has a question, but is the important factor keeping great? Oh, so John's asking, this is how the debate has evolved. And Aaron at Squat University and other people have said it. They'll say, okay, fine, we recognize that the spine is flexed when you lift heavy, but they're not moving it. It's braced and they're moving at the hip, and then they move the spine later. Well, that has been looked at. We're going to see it later with a study by Tyson Beach, and the spine moves quite quickly even under load. So sure, it's braced. You do have muscle co-contraction, but it is also extending under load. So I've heard this argument that there's just a flexion moment, and that there's not a lot of flexing movement. And that doesn't seem to be happening when we look at the kinematics of it. So that's a good question, and I'm glad you brought it up, but I do address it later. So our clinical debate here, and our struggle with our athletes and patients is, do we expose and adapt? Meaning you can flex all you like, we just got to get the dosage right. You'll adapt, your muscles will adapt, your disc will adapt, or do we avoid and protect? And we kind of say, adaptability is very limited, it's finite, it's better to back off. And so that's the struggle that we all face here. So we're going to look at 4 areas: epidemiology, how people lift, animal models, and biomechanical studies. So the epidemiology is weak. So you'd think there'd be all these studies measuring people's spine flexion while they lifted throughout their life or at a job. And then we'd be able to say, wow, you're more likely to get injured if you flex a lot. But the problem is we don't even normally measure lumbar spine flexion. What they tend to measure is just where they lifted from, like floor height, knee height, and how much the trunk was tilted forward. But you can tilt your trunk forward and have a relatively straight lumbar spine, or he can tilt it forward the same amount and have lots of flexion. So that's one of the issues that we haven't really done this research. When they do it, and there's not a lot of work, flexion is not an independent risk factor. Well, we do find if you're someone who has a job and you're lifting a lot every day repeatedly and not training like an athlete, then load itself is a risk factor, right? And so that's Peter Conan's work. He found lifting load was a potential risk factor, but spine flexion itself, when they measured it, didn't seem to be. And he's really interesting. He's a true biomechanist and epidemiologist, and he's really, I remember bugging him on Twitter a few years ago. He's really backed off what he thinks. He's like, yeah, it's important, but it's even in and of itself, it's not that important. Where his own research is quite interesting, where I'll just read some of this. Blah, 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 blah. So those lifting over 25 kilograms, the incidence of low back pain would increase by 4.32% compared to workers not being exposed to lifting. So even lifting a lot isn't that big of a risk factor. So it shows up statistically, but you're like, well, does it really make a big deal? And same with a lot of these systematic reviews. This might surprise you, but in terms of causation, when they do prospective studies, physical loading doesn't always seem to be that great of a risk factor. And all of you who are strength coaches, you know this, because what do we do in our training programs? We expose people to load because we want to get them to adapt. I do think there might be something in some of our interventions with, if you ever work in an occupational setting, of treating workers more like athletes, where you give them down weeks and then you build them up and then you have good training, but that's one of the issues. So some implications from the epidemiology is like, there's not a strong indication that altered postures cause pain, but sometimes you'll see an association. So sometimes, and this is very inconsistent, you'll see people with low back pain and they tend to flex more. But then there's other papers where there'll be a link where people who have low back pain tend to flex less. So those cross-sectional studies are kind of weak. You can't really imply causation. So if you're working with athletes and they have pain doing a deadlift or a squat, and it looks like they flex their spine a lot, it's totally reasonable to teach a more neutral spine, or brace more, don't bend as much if you can. That's not unreasonable. That's just backing off. And then slowly over time, you reintroduce flexion. So a thought experiment would be something like this. We need more studies like this, where you take two groups of 500 people and you have good training where they increase their training and spinal loads throughout their life. And the only difference is one group tries to minimize their spine flexion and the other group doesn't, but they have the same amount of loading on them and you have good training. And we'd want to find out, is spine flexion really that bad? And so some of the historical studies that try to look at the idea of stoop versus squat. So what is this, 21 years ago that YAP did this? Even back then, and I don't know how the debate isn't still raging, they were arguing the biomechanical literature does not support advocating a squat or neutral spine technique. And then in 2002, same idea. There isn't really a lot of support for having a better lifting technique. Now, I know all of this is in like the occupational setting, in a sports setting, and people who lift, you know, for performance. The research just isn't there. So we kind of like take the occupational literature, because there's funding for that, and apply it to what we think is going on in the gym. So how useful is teaching people to avoid spine flexion when they lift? In general, these programs aren't successful. So going in and teaching people how to lift the right way, and I used to do that 25 years ago, they don't seem to work. That's these studies. The problem with those studies is they never really measure spine kinematics. So although you might be teaching people to lift differently in the traditional, more neutral spine, they often don't measure that. So they might not be good at just changing how people move. So it could be poor coaching going on. And it's hard to change those postures when they do measure it. So going to this idea, and this is my big thing that really changed my views, is, well, if flexion is a risk factor, can you even avoid it? Because if you can't really avoid it dramatically, then what does it matter? Why are we worrying about this? Like, if you're a runner, the way you get running related injuries is running, right? If you want to avoid it, we'll stop running. And I sometimes worry that's what's going on with lifting. Maybe spine flexion is a risk factor. I don't think it is, but I'm not sure that we can avoid it. So some people, I actually think spine flexion is useful, and that's, you know, these people lifting like this. So the question is, how much can we modify it? So we do have some research. Corey Eddington did a master's thesis. Not some of it was published, but not all of it. And he found that during, you know, squats, there's about 60% of max spine flexion. So what someone does, they flex forward all the way. You measure their spine flexion from L1 to S1, so just the lumbar spine. So with squats, trained powerlifters would flex around 60%. And then in the deadlift, it was around 75%. And then Tyson Beach, who's a great biomechanist to follow, he's a good coach, strength and conditioning coach too. He tried to give a simple cue to people. So not coaching, but just cueing, and said, try to lift more with your legs, don't bend your back. He showed that people can modify their flexion about 7 degrees. And so that's about 14% of max spine flexion. So here's me lifting light loads in my little clinic. So I'm trying to not flex my back. So how much spine flexion do you think is going on here? And this isn't comfortable. This actually hurts. I don't normally lift like this. I don't even like, I feel weaker. It's painful. With that motion there's like you go down, I get into position. That's me in position. That's the start of the lift right here, right? So right, and then this is me standing back up. So you don't come back up all the way to full 0. So, but I had around, really forcing an arch, about 55 to 60% of max flexion. That's right around here in those 3 lifts. And then my next lift, which this is where I feel strong and comfortable and I have less pain. The only difference, the hips are the same. This is my natural deadlift style. And I don't lift a lot. I only do about, well, my goal is 2 times my body weight, and I'm almost there. All you 4 times body weight people are laughing at me. So that spine posture there, which is a little bit more. So it's right, how we measure it. Let me get, so get into position, I get set, and right there is where we start to measure. So right off the bat, as my hips and knees extend, my spine starts to extend too. So to answer John's question. So here I get into position, and then you notice I don't really crank and arch it. It stays around here, and I'm at 65 to 70% of max spine flexion. So my max, I would go down and touch my toes, right? So this is sort of what the research is showing. So I was able to modify my spine flexion, pretty much exactly what Tyson showed, around 7 degrees, or about, 13 to 16%. So I'm a little bit less than the trained power lifters. But that was not a lot of weight. I think that was only 95 pounds there. I think those were just 25s. I should do it again, lifting my heavy amounts. Heavy is in quotes. And then with the squat, no, not a video. Nice. Oh, shoot, there it is. I do have a video. Sorry, there it is. I went deeper to, if you go into a butt wink, you will get over 90%. And this is me just doing a pretty relaxed squat. That's neutral for me. And we saw a lot of variability, actually, about 56 to 70%. If I really force it and don't go to thighs parallel, I can be around 50. So this is pretty consistent. So even when it looks relatively neutral, you're still flexing a lot, because no one would really freak out over my technique. You would just freak out over how weak I am. All right. So the point here is like flexion is unavoidable, but it is modifiable. And so, but just not too much, but that might be enough to take the edge off when people do have pain. So you will hear people say, oh, you can't help but flex your spine. That's true, but you can still change it, right? So I wouldn't mind working with a better strength coach than me for suggestions on performance. And if I was in pain, I would certainly explore, and I do, other movement options when I lift. It just, for me, with my low back pain through the years, I feel way better when I deadlift or squat with a little bit of flexion, with consciously trying to flex. So Kathy's asking, yeah, sorry, the markers are at T12 and S1. Are the markers does not look like a flex? I know this is the amazing thing, Kathy. This is so consistent across the literature. We're thinking of doing a study like this, at how well strength coaches could assess lumbar spine flexion. And what usually happens when you look at someone and think they're in a neutral spine, and I did this with my daughter, it's their thoracic spine that moves more. That's what you can change. So you can change the position of L1 or T12, but if you just measured S1 to L3, I think there's even less modification there. So I know it totally looks like the spine isn't flexed, but the lumbar spine is. It's really shocking. So some questions with no current answers. Sorry, you're not learning anything today. What's the variability across experienced lifters? We've been talking about doing that study, how much variability is, and can we modify the spine flexion under loads? What's the possibility there? Or what are the other attributes you need, like hamstring flexibility, calf flexibility, to really help modify your spine flexion? And then, at an individual level, how is force production different across different techniques? So I actually believe a lot of good coaches they figure out the right way to lift, and then they have a little bit of a bandwidth there on how they choose their spine flexion position for people, and they figure out the right thing for that person in front of them. So there is other research out there where they do this, they measure it the same way I did. People are trying not to flex their spine, like they're trying to keep it lordotic, and they're still 30 degrees. A fully flexed spine, kyphotic, is 41 degrees. This study here, she looks super duper neutral. That was 20, that's Lori Holder's study. That had 22 degrees of spine flexion there. This is Corey's study with these powerful men and women. And again, this dude here was getting, with the deadlift, over 70% spine flexion. Like there it is there. So the deadlift, that's that 75 to 80% spine flexion. In the squat, more like me. And we should notice the range. You are going to have people with less than 70, less than 65, depends how deep they go as well. So you're going to see variability across people. Again, there's that deadlift, looks super neutral, but as soon as you start to flex your hips, your pelvis starts to tuck. So he's neutral up here, but the pelvis is going into a bit of a tilt. So that's probably why we're seeing it. And someone asked John about the motion. They're sending me this paper, but right around here is when the hips started to move, and then the spine started to move as well. So, and then but there is variety. They measured spine flexion, but that wasn't the idea of this paper. It was just spine flexion versus Fms scores. And so this is people doing squats. And so some people had not a lot, this really surprised me, but like 20 degrees, I think, because they didn't normalize to max, and then up to over 60 degrees, or that was, I'm not sure on that one. But we see variety. This is Andrew Vygotsky's work, people doing a good morning. So trying to keep a neutral spine, again, 25 to 27 degrees of spine flexion. The max, the average spine flexion, the average max for most people is around 50. So again, 50 degrees. This kettlebell swing, you have one of the best biomechanists in the world, a leader in the neutral spine. They would have taught them to do a kettlebell swing with a neutral spine. What do we see? 26 degrees of spine flexion, right? Which is probably around 50% of max. And that was the lift. No one would freak out and think that's a lot. So there we see lots of spine flexion. When you're jumping, lots of spine flexion. Yes, so John asked about anterior pelvic tilt. Listen, the anterior pelvic tilt is only occurring at the start. As soon as you as soon as you drop your hips, you start to go and you start to flex. So is it a risk factor for pain? You're not going to find any research supporting it, but guaranteed you're going to find someone who walks around in lots of extension and it aggravates them. So it's always reasonable to try to change it as a symptom modifier. That's just my opinion. And then we see, this is an old video, me backflipping. You're going to spine flex. I do tons of sit-ups this is my first backflip in 20 years. It's not that bad. I almost landed on my face, but spine flexion, normal. So I don't know why we vilify it. But again, we can modify spine flexion, just not that much. John asked about this. This is the Tyson study on lifting and lowering with the spine during the lift. So there's the start of the lift all the way down. You do see how you get spine flexion as soon as you start standing up. Like if you didn't, you would see the line be parallel, straight across. But as you start to stand up, the spine starts to extend. So this idea of not moving the spine under load, I would like to see that explored explicitly in studies. I'm just inferring from the research that's out there, but it seems like it's flexing. So I don't think, despite what Aaron says. So the bottom of the lift is 100%. Notice that extends at the start of the lift and extends most of the halfway up. Like it's just extending the whole time. I'm gonna correct my grammar. And I would argue we need spine flexion. It's what we need in all kinds of sports. I don't know why we're vilifying it. And then one of the reasons why people have said not to comes from the animal modeling. And I would be hesitant hanging my hat on that research. So what they do is they take cadaver spines, a motion segment, they put it in a jig, and then they're just going to bend it forward and backwards. The issue is, this is Jack Callahan's work. They've done a proof of principle. Yes, if you bend a dead pig spine 86,000 times with low loads, 1,400 newtons is like 140 kilograms of compression. That's God. Maybe you might get that with a body weight squat. It's not a lot. You can create a disc herniation, right? What's interesting with that study is they went to what they called the end of neutral. Their neutral is a bit weird, but it's 35% of peak flexion, where flexion was they just bent it until it broke. So probably in the human spine, it's probably not 35%. I'm not sure exactly what it was because this hasn't been well studied in human spines, but it's not max flexion. That's my point. It's probably 50% of flexion or something. So their proof of principle was that if you bend the spine a little bit repeatedly, the disc herniates. And we see this in other studies. If you bend the spine repeatedly, the disc herniates, but the disc can also herniate in neutral postures under heavy loads. So neutral in and of itself isn't protective in these cadaver models. So my issue is, should we care about those cadaver pig spine studies, right? They're telling us you're going to get injured, but they're injuring the spine where it's hardly moving a lot, right? Is this something that's avoidable, or is it even relevant? Because they'll take a dead pig spine and bend it back and forth thousands of times. Does anyone do that in practice, right? So if we believe that these cadaver models are valid, then we're all doomed to fail, right? These scenarios aren't avoidable in terms of the amount of spine flexion, right? They are avoidable because we don't move our spine thousands and thousands of times. Like we have this ability to adapt. We see the same thing with runners and knee osteoarthritis. If you just base it on the way a cadaver knee responds to running loads, every runner is going to get knee OA in a year. But that isn't what happens. right? We don't see more knee osteoarthritis in runners or people who strength train. We have the ability to adapt. So what I'm arguing is those are valid studies for high load injuries, but maybe they don't represent what happens, with humans who strength train or lift. So again, small amounts of motion, and if you load it up, you'll see the spines breaking. It's just not relevant. And those spines will have damage when they're neutral or inflexed, right? So I'm not sure that we should care about these studies, right? Because when you're strength training and deadlifting, how much do you deadlift? What are your working sets per week? 9 in a heavy week, 12, of heavy loads. And maybe what, five reps at the most per set? Like you're doing maybe 40 heavy lifts a week. Like really, why are we worried about that? It doesn't really make sense. And you have all this recovery time, right? So the issue with the relevance here is like, that's dead tissue. There's no potential to adapt. There's no rest with those, the trunk bending, whatever, who cares? It's 80% or 100% of max, which I doubt most of you are lifting with 100% of max. So I'm not sure why we're worried about the spine flexing based on cadaver studies. And so are you just going to stop rowing, playing golf, tennis, squatting, living? It doesn't make sense to have this movement pessimism to me, right? So, and the live animal models, to me, it's more optimistic. So we need to reconcile these. What we see is these are just, they measure rats and they compress it like a rat tail from the 80s. What they find was, just compression, which is in a neutral posture, causes the disc to, become damaged. But no one would say, don't lift in neutral. What it means is make sure you recover properly. So if you compress a rat tail and then give it time to recover, it actually gets stronger. If you compress it for a whole month, right? Yeah, sure, it wears away. So I'm not sure we should really be led by animal research that much. It doesn't really seem to apply to humans. And so again, we learned when you compress the disc, it causes, matrix compression, and it will wear away if you don't have time to recover. But no one freaks out about compression in neutral based on these studies. And then what this guy found here, there's dosage hope. If you compress it, back off, compress it again, back off, like good strength training, the disc gets stronger, right? And that's this study here where they, evidence suggests that there's a threshold effect observed, where the disc can adapt. So likely from anabolic response from dynamic loading, whereas static loading, meaning no recovery, leads to a catabolic response. So no shit, don't do too much too soon. And this one is a cell culture animal model where 10% of disc strain, like flexing the disc, led to the disc becoming stronger as long as you have the chance to adapt. And we see this in studies on runners where the load on the spine, their disc can become stronger and healthier. So, maybe it's just load and recovery. That's the most important thing rather than the position of our spine. So just quickly, biomechanical models here are conflicting. That's the other way that people will argue about worrying about spine flexion. So they measure, they're incredibly complex, beyond me as a biomechanist. I respect the research, but they make lots of assumptions about what's going on in the spine. So yeah, there's a number of studies. This is the Potvin-McGill model. When you have a really flexed spine, they measured more shear at L4, L5. And then if you kept your spine more in neutral, there was less shear. So that's often been the argument for keeping a neutral spine, is that there's no shear, so it's not going to go forward. Oh, someone has a question. Yeah, so Kathy's asking about, are there studies that measure the spread of L spine flexion between T12 and S1? So you would really need video fluoroscopy for that. So there's really not much of those. There's a McGill paper from a long time ago. And there's some studies that measure T12 to L3 or L2 and then L3 to S1. And again, they're all flexing. And then, Kathy, to be honest, some weird things happen segmentally. Sometimes you can be flexing and sometimes a joint is extending, like they'll behave differently. So it's odd. So I don't have a lot of answers there. Uh-oh, kids are home. What's my view on core training, where we try to not move the spine, such as planks? So yeah, that's probably how you want to choose your exercises. What are you trying to achieve? If someone has a sport where they need to achieve a stiff spine that doesn't move, so for me, this is when I rock climb. It's good to do that. I want to be strong and stiff and not move under load. But I also do gymnastics, and so I actually need to do sit-ups and I need to do leg raises. So I make it a training load goal, training goal. Like what are you trying to achieve, rather than thinking of what's the safest spine position. Again, so that paper there where the shear was greater, what's interesting, their neutral spine still had, the squat had 39 degrees of flexion, and the flex spine had 49, so around 80%, right? So, and then compression wasn't the same, it was just shear that was different. So we won't get caught up in this. So here's the issue with these biomechanical models. They disagree because they make assumptions and they measure things differently. So other people have said, when you flex your spine a lot when lifting, I gotta move this, sorry, this one here. When you flex your spine a lot when lifting, that's this here, the stoop, there's less shear on the spine. The problem, I've talked to Tyson Beach about this, who's a biomechanist, and he argues that that makes sense. It's because they're measuring or estimating the load at L5, S1, whereas the other model estimated the load at L4, L5. So, and they made different assumptions about how their model should work. So when you make different assumptions, you'll measure different things. So the point here is, like, the biomechanical modeling is conflicting. So again, we should be hesitant about giving advice on loading based on these modeling studies, because it's not straightforward. And then the most recent paper, really up to date, a biomechanical model that they've been working on for 20 years. They measured compression, shear, how the discs were loaded, or estimated the loading on the disc, the ligaments during kyphotic and lordotic lifting and freestyle. And again, they found the same thing as everyone else, lumbar flexion. So they would bend forward like 40 degrees, and then they'd bend forward 65 degrees. And one time they said, okay, just do it however you want. And then they said, don't let your spine flex. And then they said, really flex your spine. And they found the classic things. You can definitely modify the amount of flexion, right? Lordotic had 20 degrees. Kyphotic had 35, but you still had flexion. And then when you went deeper, it was harder to modify. So 30 degrees of lumbar spine flexion and 40 degrees here. This is probably not quite max, but getting close to the max, right? So let's say the max is 50, which they didn't report. It makes sense. They had, 60% max flexion, and here they had 80% max flexion. That's, pretty consistent with what we see in the other studies. And what they found was compression and shear in the increased in the lordotic postures, right? And the shear felt by the disc was slightly less in lordosis, but not really a lot. And then passive structures. So when you bend forward more, there's more stress on the passive structures, the ligaments. That makes total sense. We know this. It isn't inherently bad. And the active structures, when you increased with the lordotic posture, so the muscles were working more. And this is why people sometimes choose to lift with a more flexed spine, because there might be less stress on the muscles, but they're still getting an extensor moment from the fascia, from the lumbodorsal fascia, from the ligaments in there, and the muscles as well, because they just have passive energy return. So your muscles have to work more when you try to maintain neutral. And interestingly, maybe this is the tiebreaker, the disc strain just was the same. It didn't really matter trying to maintain lordosis versus kyphosis, right? And the argument here is you might have all of these other structures that they take up the load first, so the discs really don't undergo a lot of stress. And I skipped the slide from earlier, and that's what Patricia Dolan, a biomechanist who's retired now, was arguing more than 20 years ago, that unless you go really crank into end range, you might not be getting a lot of disc stress, right? So this is the issue with biomechanical modeling. It's not telling us a lot either. So she's like the disc strain, this study here suggested that the disc strain was negligible. It was around 10%, which is interesting to me. I know it's not the same, but remember that animal modeling study? They said disc strain of 10% was a good stimulus for adaptation. All right, so a quick opinion here. It's going to be like, well, duh. Maybe we just use symptom modification as our guide. If it hurts to flex, okay, maybe we back off. And we can never know the source of like nociception in the spine. So be driven by sport performance or be driven by, changing symptoms. All right, so again, I'm just wrap up here. We just have to, our view of like how optimistic you are on spine flexion is probably how you view adaptability. So if you think the spine can adapt, then you're comfortable with this. If you think that we have a limited number of flexion cycles, then maybe you're like, what is the point of doing this exercise? Although you could probably ask that all the time. And so our question is, are you going to pay for it later? And there's only one study that I know of. They looked at cross-country skiers, rowers, and people who didn't flex their spine a lot. And you weren't more likely to have future low back pain when you were a rower or a cross-country skier versus, doing orienteering where there's less flexion. So quickly, sorry for the information dump. To reconceptualize, I don't think we should be worried about low levels of flexion. It's just our bodies can adapt to that, no problem. We definitely shouldn't be creating a fear of flexion in our patients. I just had someone earlier today who's just terrified of like bending forward, and he trembles and has tremors and freaks out with flexion, and it's a real issue. I have those patients every week. And then, I just think flexion is normal, it's unavoidable, and sometimes absolutely optimal for function. Now, here's where I get on the fence, and I still recommend, totally respect strength coaches who want to train in more neutral, because I still recommend it too. But I recommend it because it's for sport performance. Trying to have that neutral stiff spine is the right position for performance or whatever sport you're playing. Maybe if someone can't maintain a more neutral spine, I'm like, well, you should be able to do this as well. You always lift flex. Let's do some lifting where you lift less flex so that your spine has this robustness in all these different positions. Or maybe you have an activity where you're always flexing your spine a lot, and that's aggravating for them. Well, let's back off of doing that in the weight room, and we'll do some other movements. So we'll give you a break. And then related to that, we back off temporarily when it's sensitized. So actually, I won't get into this one. So I would say perhaps our technique decisions are determined by other biomechanical factors than lumbar spine flexion. So, maybe how we choose our technique is, well, be prepared, just train smart, don't be stupid, keep the load close to the person, optimize strength, power, endurance in the other joint positions. So choose your deadlifting squat technique based on getting the optimal positioning in all those other joints. And sometimes that means you put your spine into flexion to get into the best hip flexion position. For others, it's more of a neutral spine to get into that position, right? Choose specific patterns for you that optimize your strength. So I just feel stronger in this position. So that's what you want to train. And again, I still value the wisdom of strength coaches through the years, but maybe our targets need to change a bit. So second level recommendations, like I personally believe in variety. If you have a history of one style, then that's it. That's what you do. You don't need to change it, and change it if it hurts, but without any change, do it slowly. Oh, I got it in on time. Sorry, just have to apologize. I know I'm like flying through there. So another question here. Based on this, what do you think are the common factors for lower back pain, particularly in athletes? Oh, it's it's everything. That's like asking what's your favorite ingredient in a cake. It's so multifactorial. I often think when it comes to low back pain, in some ways it's just about managing low back pain, and it's harder to prevent it. So when it comes to low back pain, it's everything related to good training. That's what I think. So it's like sleep, recovery, diet, giving yourself a break, having an active social life, having like smart training where you don't do too much too soon. You have deload weeks. You're not always going to failure, right? So often like good training is also like good injury and pain prevention. That's my opinion. Like I always argue that strength coaches are the original biopsychosocialists. I think they've been doing it well before therapists were. They just didn't call it that. When you worked with an athlete, you knew that everything in their life influenced their performance. And it's the same thing with pain. Oh, here's the chat, which I totally missed. Shit, this is from half an hour ago. Are these 1 RM scores or several reps? I have no idea what that's about. If it was people lifting and the studies, the Eddington study, they were lifting, I think 85% of their max. It was heavy loads. When I was lifting and it was my spine kinematics, which is just for this, it's not a scientific paper. It was, oh God, I don't know, like 40% of my max or something. It was pretty light. So this is a bit of a debate. In rowing, we found lots of cycles of flexing, and back pain is the most common injury. It is. But what we haven't seen in rowing, you're going to flex your spine no matter what. So you don't know if it's the flexion that's the problem or the fact that you just use your spine more. So you don't see spine flexion as an independent risk factor in those studies. So although they just came out with guidelines on rowing where they made a conclusion that spinal flexion was bad, the papers are questionable because what they did is they just had people with low back pain and people who didn't, and they measured their spine kinematics, and they said people with low back pain had more flexion. Well, that doesn't mean the spine flexion caused that, because then there's one study where they got people better. They recovered from their low back pain. They measured their spine flexion and it didn't change. So it's not something that gets in the way of recovery. But that's, Ivan, that's a good one. It's a bit debatable. So Michael asked about the inconsistencies. Wouldn't it be the focus? Oh yeah. So so they do have these big conferences now where they try to model the spine. And if you notice, that's why I cite that 2020 paper. The other papers are old biomechanical models. And I don't know if they're up to date. That's the thing. That these are very smart people. And the thing is, like all academics, they probably disagree on the right way to estimate the loads in the spine. So that's why you're seeing those differences. So they make different assumptions. Like sometimes they'll measure EMG to guess what the muscles are doing. Other times they optimize it, meaning there's no EMG. They just sort of guess what the muscles should be doing to balance all the loads in the spine. So they all have trade-offs. So they have their positives and their negatives. And then we end up with these differences. So yeah, like you want to put them all in a room and say, figure it out, but no way. Yeah, so there's a question here. Hi, Greg. What about the newer models of Van Dien and colleagues speculating about an association with reduced lumbar flexion, tight control strategy, and increased muscle co-contraction, potentially leading to increased load? Yeah, so he's been arguing that since at least 2003 and before that. So that I think they're being movement pessimists too, because the tight control strategy and the muscle co-contraction, that's called the cost of stability. It's really not that much of a load. Like to stabilize the spine, it doesn't take a lot of co-contraction. you know, like you might have 10% activation in the abs, like a heavy squat, you're not getting a lot of muscle activation in the abs. So I'm not too worried about that either. I know they're worried about those ideas, but I don't know why we vilify load. I have an issue with that if you're always doing it and it leads to pain and then you keep doing more of it. But that's a bit debatable. They're being afraid of load, whereas someone else is afraid of flexion. Any other questions? I got two things going. You can ask them out loud too if you want to turn your mic on. If that's allowed or able.
I think, Greg, there's one or two that you might have not answered just in the Q&A. If you just want to hop on there real quick.
But I will stress, if you're interested in this topic, it is, I don't know why I didn't have it in. I should quote myself. We do have a paper on it, me and Louis Howe. I don't even remember the name. Sorry. It's something about getting out of neutral. So if you Google like Louis Howe and getting out of neutral, or my name, or email me, I don't even know if I have a copy. I can send it to you. But it goes to the details. But honestly, like, and I have a blogs on this from 2016. It's I would suggest you have an open mind and get uncomfortable being uncomfortable with having this doubt. Oh. So Kathy, what's this? There is a parallel, the disconnect of my glasses of BIM with pain and chronic pain. Yeah. Could you clarify what you mean by that? What's BIM? 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 Body? Huh? BMI? That's what BIM is? Oh, yeah. Oh, so yeah, when it comes to persistent pain, there's a massive disconnect between biomechanics and pain. So yeah, it's complicated. I would agree with you. I could probably ask John's question a bit more easily. What is my opinion on loading rotation? Yeah, it's funny. It's the same thing where we did the same thing with rotational movements as we did with spine flexion, again, based on like cadaver studies and biomechanical studies. Sure, without a doubt, like if you want to herniate a disc with a cadaver study, going out of neutral and moving a lot and adding load, that's gonna do it. And so you just have to question whether that happens in real life, right? And so, yeah, sometimes rotation and twisting when you lift in the occupational setting seems to be correlated with more pain, but I'm just of the opinion, if you have demands in your life that require twisting, then you should prepare for it and you should train it. I think the spine moves. Somewhere along the line, people decided that it's all anti-rotation and anti-extension, and I just don't see that. Like, if anyone golfs out there, you're rotating your spine. It's part of the kinematic sequencing. If you run, it's rotating. You would never keep your spine rigid when you're running. It's part of it. It's producing and transmitting force. So I don't know why it became so popular to think that we need a stiff spine. I do think the less time if anyone wants to do a master's thesis to disprove this idea, the less time you have to produce force, the stiffer your spine should be. So if you quickly throw a baseball or a jab, like in boxing, your spine will be stiff. But if you throw a baseball like a pitcher, we have lots of time to produce force. The spine is part of the kinematic motion and the sequencing. Same thing with kicking, right? If it's a quick jab, you want to be stiff. Same thing with jumping, like running and jumping off of 1 foot, not a lot of time, high rate of force development, you hardly move your spine. But if you're jumping off of 2 feet, you're going to get the spine involved. It's just my theory. So Ivan, thanks. To think movement with isolation of segments in rowing, there's a clear correlation between kilometers and low back pain for sure. Yeah. So here's another question. So there's the chat and the Q&A. So it would be sensible to assume that injuries attributed to spine flexion are from inappropriate spine adaptations. That's one theory, that it's just like too much too soon and has nothing to do with the position of your spine, or the loading isn't relevant either. It's think of load as all the other loads in someone's life. So something else is sensitizing, and that's where the beliefs and worries and rumination, you know, and stress and like poor sleep and all of those things, you know, become important. So here's a question about McKenzie. Thoughts on McKenzie technique for low back pain assessment? It emphasizes the law and extension. So this is what's neat about McKenzie. It's a lot about directional preference, meaning someone has pain, you find out what aggravates them, and then you find out what feels better. That's their directional preference. So often it's extension, but not always. But what McKenzie always did was he would do extension for a while, and then he would start to reintroduce flexion. It wasn't about avoiding forever. You do the directional preference of extension, and then you go back into flexion, and you can tolerate that again. Failed McKenzie syndrome is when people do McKenzie and they haven't been trained properly, and they just do the avoidance, and they never reintroduce the flexion. All right. Did I answer everything?
I think you might have just got one or two more, Greg.
Shoot. There we go. Sorry.
No, it's okay. You might have just got one or two more. So I think there's one from Matt in the chat. So it's interesting to look at how kids lift.
Oh, Louis here. Amazing. I'm glad I gave him a shout out. So whatever Louis' question is, he can just go read his own paper. There's a question from Mark. Where?
From
Matthew. Okay, I'll read that first, and then. Yeah. So it's interesting to look at how kids lift as they're lifting naturally. As we get older, some of us change the way we lift based on many myths. Yeah, probably. Yeah. So I don't think it matters. I think we progress gradually. I say that. No, I don't think under heavy loads we naturally figure out